Today, I want to talk about one of the biggest misconceptions in cancer, and that is, how does a doctor know for sure what type of cancer a patient has? Now, that seems like a pretty straightforward question, right? Well, it's obviously wherever they got the biopsy, but that's actually not true, because we know that we don't always find cancer early where it originally started. So every cell in our body looks different under a microscope. So imagine, for demonstration purposes, that our breast cells look like this under the microscope. These are what our lung cells look like. Maybe our liver cells look like a circle, and the cells in our bones look like a star. So when a patient comes we get a biopsy report. Imagine that under the microscope, the pathologist looked at the tissue, and it looked something like this. What kind of cancer do you think that is probably going to come back as? Likely it looks like it's going to be breast cancer. So then we try to compare it with the clinical picture. We read the pathology report, woman had abnormal mammogram, got the biopsy, looks like breast tissue cells. Then we do some additional stainings to confirm that's indeed what the diagnosis is. But what if this patient was your mom, and she went in for her annual exam, and the doctor did a chest x-ray, they see something a little fuzzy there, we need to get a CT scan, there's still a spot that looks suspicious, and they do a biopsy in the lung, and the pathology looks like this under the microscope. What kind of cancer do you think it is? Still breast tissue. It's not about where you do the biopsy. It's about what it looks like under the microscope. So this is a huge point of confusion for patients, because I hear patients who say, well, I had breast cancer, but now I have lung cancer, or now I have liver cancer. You could potentially have a second primary, but much more likely it's actually a cancer that has metastasized or gone beyond where it originally started. So it still is breast cancer. Okay? So if you hear patients talk about this is really a subtle thing. They're a little confused about it. It takes about 2 minutes, as you can see, to explain this to them. Okay? This really decreases their anxiety, because when they're getting their treatment, I've had patients tell me, well, I know this is taking care of my breast cancer, but what about the cancer in my lung? It's the same thing. It still is breast cancer. It just has traveled beyond where it originally started. So whatever treatment your doctor's prescribing if the breast cancer tissue cells are going to respond, it will respond anywhere in your body. So it's a really important thing to clarify for patients. It decreases their anxiety and really helps them understand much more about their disease.